It's so nice seeing patients in their own environment, relaxed, able to recover quicker.
We call urgent community response when a resident needs assistance, but we don't want to be calling 999 or 111.
Instead of having a referral into a service, we can just transfer care between services, so we've got that seamless approach, which is a better patient experience.
When we say Kirklees Urgent Community Response, we're describing a collective set of health and social care services that deliver crisis and urgent response, usually within 2 hours for the most vulnerable people in Kirklees. Part of that also involves supporting people in their home to maximise their confidence, maximise their independence. Recovery at home, probably the best thing that can happen rather than be in a hospital setting, which could place additional pressures and demands on the NHS. The last 2 years have been probably the most unprecedented. The challenges that we've been faced with through the pandemic, increasing demand, a lot of additional pressures. One of the things that's been positive though against that backdrop, the teams have come together, services have come together, people have come together in ways that previously were unimagined.
Locala work as an alliance with other services, with the local authority, with Curo, with the local care direct, to provide this service together to ensure that patients receiving the best quality of care at home.
Anybody who has a crisis response can come through the call centre in the hub. We'll do a triage and we can support them to go out and have a face-to-face advanced clinical practitioner. We can support them clinically. If they've got any social care needs, we've got social care assessors to go out and support them, and then we can keep them out in the community and provide the care, and we refer them to relevant services.
So the Urgent Community Response team take referrals from GPs, other community services, the local ambulance service, from secondary care colleagues, directly from care homes, and we now take self-referrals. We would attend within that 2-hour response time frame. We would do a full holistic assessment on each individual. We would clinically examine the patient. We would diagnose, initiate treatment. We also liaise with our GP colleagues and the hospital team to ensure continuity of care for all the patients that we see.
Urgent community response been fantastic. They have avoided so many unnecessary hospital admissions. A lot of our residents that we look after might be living with dementia. A trip to hospital can be absolutely traumatising for somebody with dementia. So the urgent community response coming out, it removes that experience and allows them to stay in the comfort of their own home with people that they know.
This service has enabled us to make the offer to our patients in Kirklees more robust. How we've been able to get it off the ground, so to speak, in such a difficult time has just shown the resilience and the desire for this service for our patients in the community.
We work better together. We've got that formed partnership. We can learn from each other's organisations, so we can keep people within the community, provide that wraparound care and support.
I love working in this job. I am just so happy that we can offer this to the residents in Kirklees. We know it's had a positive impact already and it's very well liked by patients.
Urgent community response is absolutely fantastic. It's a service that we cannot do without. It has made such a difference to everybody that works here, families, residents, staff, and we're really, really grateful for the service.